In previous videos, I've talked about how one tests hearing, and in particular I stressed that there are two distinct types of tests that may occur. There's what we call a screening test, which is a simple pass-fail. The stimuli are presented at a fixed level, and you either hear and pass, or you don't hear one or more of the test signals and fail. The other test is known as a diagnostic test, and that's where we're trying to measure the absolute thresholds of hearing, and if the hearing levels are lower than normal, then we try and find out why. Where's the problem and what's the solution? Now, on the screen at the moment, we've visited the Ascent website, www.ascenthearing.co.uk. And on that particular home screen, one of the things we can select is hearing test. And that's basically a screening test. It's very quick and easy to follow, and I just want to talk about a few of the landmarks that will help you to either do it yourself or recommend someone who might be a friend or loved one who's not sure whether the hearing is spot on or not. Once you've actually selected hearing test, you'll come to this screen that's showing at the moment. And what this is actually saying is that there is a 5-step process involved in one testing one's hearing. It might sound a lot that, but believe me, it isn't. Now, one of the first decisions that you need to make is, are you going to use headphones to do the test, which come with your computer? It doesn't have to be a laptop, it can be a PC. Or are you going to use the built-in or plugged-in speakers? Remember, if you use speakers, you're only going to test your better ear. You can't isolate your two ears. But if you use headphones, the test enables you to do the right ear independently of the left ear, and that gives you a much better picture of your true hearing in both ears. So my recommendation is use headphones. So make sure that you plug them in to your headphone socket, in this case here on the side. And also at the bottom of the screen, make sure, in this particular case it's here, that the sound is actually set at normal comfort levels that you would wear it. In other words, you're not muted for any reason. I quite often mute my sound, particularly late at night when I'm pottering away on my website, so that I don't disturb my wife who might be asleep next to me. So just basic common sense things like that will help. Now, what's going to happen is with the test is you're going to go through, as I said, a 5-step process. And basically, first thing that's going to do is ask you a few simple questions, and all you do is answer yes or no. So if I can show you an example of that, I'll click on the next screen. And what we're going to actually now do is answer a few questions. And the first question it's going to ask me is, do I sometimes have difficulty understanding speech on the telephone or the television? Very common sort of complaint that people have, where the edge of the hearing has just been nibbled at. And you either click yes if you have, or no if you haven't. So I'll click yes, because I do sometimes have problems on the phone. The next question that it's asking me is, sometimes do I feel that people are mumbling and not speaking very clearly? So rather than it being my hearing that's to blame, I'm blaming other people. And again, click yes or no. So I'll click yes. Third question, do I find myself asking people to speak up or repeat themselves? Does that ring a bell? If it does, click yes. If it doesn't, click no. Well, in this case, I don't actually recall having that problem, so I'm going to click no. The fourth question is, do I sometimes experience difficulty understanding soft speech, maybe female voices or young children? So again, simple, click yes or no. So I'm going to click no on that one. And the final question, and as you can see, I've only been going about 30 seconds. Do I sometimes find it difficult to follow a conversation, particularly if it's a noisy environment, a group of people, a restaurant, crowded room? So again, I do actually sometimes have a problem there, so I'm going to click yes. That's the end of the questionnaire, and then you move on to the second bit. And as I told you earlier, the decision now is, do we use headphones, and I would strongly recommend using headphones, or speakers. Because if you're using speakers, you'll only be able to check the hearing of your better ear, because you can't isolate your two ears. So I'm going to select headphones, and all I have to do is click use headphones. And now I need to set up the headphones. This is just a very simple calibration process so that the computer is giving the right output into the headphones to validate the test. And I would follow the on-screen instructions just to set the volume through the headphones to be at a particular level using this slider. Once I've done that, I click on the next screen, and what I would then do, wearing the headphones, I would check that I'm hearing, when I click on that symbol, a signal in my left ear. When I click on that, a signal in my right ear. And when I click on the middle, a signal in both ears. So it fills my whole head. And that just confirms that the headphones are working properly. Because obviously, if one of the headphones is broken, you're going to have a difficult problem hearing signals. So it's simply a matter of checking before you start. And again, this is 2 seconds of a job. So listen to my left, listen to the right, listen in stereo, and then once I'm happy with that, I move on. And the final stage of the calibration, I just have to follow 3 checks. 3 checks here. That sound 1 is comfortable, sound 2 is very, very quiet, and sound 3 is inaudible. And once I've achieved that, and I do that using this slider again here, dead simple, I move on to the actual test. So that step that we've gone through is purely a matter of making sure the computer and the headphones are set up properly to do the screen. And now all we're going to do is listen to a series of signals in our right ear, in our left ear, and we just have to click whether we hear them or not. If we hear the signal, we click we've heard it. If we don't hear the signal, we click we haven't heard it. So to begin the test, I click begin the test, very technical, and I'm now being presented with a signal in my right ear, and I have to indicate whether I can hear that or not. Well, actually, I'll click yes, I can hear that particular tone. Now I'm being presented with a new tone. It's a higher pitch tone, and I have to click whether I heard that one or not. And I'll click yes, I heard that one. Now I've got my third test tone. There are 4 in all, and basically I'm waiting now, and here it comes, a higher pitch signal. And again, I click whether I can hear it or not, and I'll click yes, I heard it. And finally, I'm going to be presented with my understanding is a very high pitched signal, a very squeaky signal. I'm listening, but I'm not hearing it. So in that case, I'm going to click no, I didn't hear it. So that's completed one ear. I'm going to move on now to test my other ear. So again, I start with the low pitch signal. I'm waiting for it to come. I can hear it, so I click yes. Now I'm waiting for the middle frequency tone. I'm waiting for it to come. I can hear it, and I click yes. I'm now waiting for the higher frequency tone. I hear it, I click yes. And finally now I'm waiting for the very squeaky high-pitched tone. I'm not hearing that one either, so I click no. And that basically is it as far as the testing of my hearing from the point of view of the screening test is concerned. So what's going to happen now is the computer will work out my results in terms of how I answered the questionnaire, how I responded to the screening tones, and as a result it will give me the outcome and a recommendation. And that's it really. That's the way it goes. That's the screening test. And then you're able to make a decision, if you didn't pass, what to do next. And my strong advice is, if you do the screening test online, or a friend or loved one does the screening test online, and for any reason there is a little problem, please contact us. Have a free and without obligation hearing test in our centre, local to where you live, and let's check that everything's okay. It could be something as simple as earwax, and amazingly we offer an earwax management service through our network of registered hearing aid dispensers who are trained and approved and certified in what we call primary ear care. So we look forward to seeing you on our website, where you can do your own hearing check. Recommend it to a friend or loved one, please, because it's great fun for Christmas. It's a great time to be doing it in these winter evenings, and it will be great fun. And see who's got the sharpest hearing. And for anyone who doesn't have the luck to pass, don't despair. Have a check in the centre where we can get to the bottom of whether there's anything at all wrong. And it might, as I say earlier, be something simple as a bit of wax that needs clearing out, and we can do that for you.